Or
Good evening, Dr. Elizabeth, ma'am.
Yes, good evening,
Yeah, I'm just uh,
Dr. Arti,
Dr.
Mr.
Arti, ma'am.
Jagdish, Chinnappa.
Good evening, madam. Good
Good
evening.
evening, Dr. Keshavlu.
Dr. Arti. Okay. A very good evening uh, to everyone, and welcome you all to this online webinar on the telenutrition, the practical tips for managing the fuzzy eaters, brought to you by the Medtrain in collaboration with the Bharati Vidyapeeth, Amrita Hospitals, Faridabad, and the Telemedicine Society of India. So before we kick off our discussion with our esteemed speakers, Dr. Elizabeth and Dr. Arti Pawaria, let's take a moment to reflect on the significance of the nutrition in our modern era. In today's fast in today's fast-paced world, where the convenience often takes the precedence over the health, the importance of the proper nutrition cannot be overstated. The nutrition serves as the foundation for all well-being, impacting every aspects of our life from the physical health to the mental acuity. A poor nutrition not only increases the risk of a chronic but also affects our cognitive functions and an emotional well-being. However, amidst of these challenges, so we have witnessed a remarkable advancement in the technology that have transformed the way that we approach nutrition and in healthcare as a whole. And I'm honored to introduce our distinguished speaker who will guide us through the practical strategies for the managing the fussy eaters in our modern era. First, we have Dr. Elizabeth. Dr. Elizabeth is the Diane in the field of nutrition, an illustrious career spanning 3.5 decades. During her career, she has served as the professor, head Department of Pediatrics at the SAT Hospital and the Government Medical College Trivandrum, and is continuing the same role at the Sri Mookambika Institute of Medical Science, Kanyakumari currently. The list of the national and the international awards the madam has been awarded are far too numerous to list. She has also added a few innovations to her credit, like Ellis Sat Mix, 3-in-1 Ellis Health Path for the anthropometric measurements, etc. She has authored several popular books, including Nutrition and the Child Development, Petty Bloom, and the Encyclopedia for the Child and Adolescent Development, to name a few. In addition, she has published more than 200 scientific papers in the numerous national and the international journals and then undertaken the research work in the nutrition with the funding from the state and the international governments. She is an active participant in the live shows of the public education platforms like a radio and a TV, and has written articles for the several magazines. Several workshops for the grassroots level workers and professionals has been conducted by Madam with the funding from NHM and UNICEF. It's an honor to welcome you to this webinar, Madam, and I'm sure the audience is eagerly waiting to hear you speak. Over to you, Madam.
Thank you. I'm very happy. Thank you, Sebastian, for that kind words. I would like to call upon Dr. Jagdish Chinnappa sir to kickstart.
Thank you very much, madam. It's an honor to be present with two of the really great people of pediatric nutrition of India, both Dr. Elizabeth and Dr. Arti. And today we are going to discuss a problem which every one of us is facing on a daily basis. That is the picky eater. The picky eater is a major problem not only in India but in all countries. And the incidence is known to be varying anywhere between 15 to 50%, almost 15 to 50% of children may have picky eating as a major issue. The causes of these are many, and this could be either child centric or parent centric, or it could be even environment centric. So there are various reasons for this. To navigate through this entire maze, a person like Dr. Elizabeth can guide us as to how we can improve parents to handle this problem of picky eating. So I thank very much the opportunity to be here today with great personalities like Dr. Elizabeth and Dr. Arti. And I'm sure that we're going to have a 1 hour of a real academic, I would say, not a picky feast, but a wholesome feast. So thank you very much, madam, and over to you.
Thank you very much for that kind words and the great insight that you have given to the topic. And I'm also happy to welcome Dr. Arti. She will be speaking also. Can you say a few lines before I start?
Good evening, ma'am. Shant here. Dr. Arti is experiencing some audio issue. She'll just come back in 1 minute.
Okay. I can't share my screen, I believe. You have to enable me. So I believe that this will be a great start for a long journey ahead that we are planning in telenutrition. And I must say that as one of our very senior professors, Dr. Srinivasan, has said sometime earlier that nutrition was taking a backseat ride. But after COVID, lot of things have happened, and many people have come forward asking for some advice regarding nutrition, or they are very much interested in listening to topics on nutrition. And that is how we are here. And I can see a lot of participants joining from different parts of the region, from India and abroad. And I'm very happy that this will be the beginning of a huge journey that we are starting. And we are starting with a very interesting topic, that is young child refusing to eat. So my child doesn't eat. My child is a picky eater. I think almost all of us have said it sometime when we were rearing children or when we are practicing as pediatricians. I'll take you through two or three cases so that you will understand how common it is. And Dr. Jagdish Chinnappa sir has said that it is almost 50%. And see, look here, Eben, his 2-year-old male child. He's eating only very small quantity. His mother has served a lot of food in front of him, very tasty, delicious, but he eats very slowly. He's not interested in food. Sometimes he nibbles at biscuits, drinks milk, not ready to try even a new food. But he has no illness. And he is labeled as picky eater and is often brought to us. Now we'll see another child, 4-year-old Amit. He eats very small amounts like the Eben. Do not eat fish or vegetables. He is very choosy, takes a long time to eat. That is, we say that not more than 30 minutes should be a meal time. After that, the food should go back. Then only the child will understand that he has to eat during that time. Otherwise, parents go on lingering. And he never finishes a meal. He's not ready even to try a new food. Meal times are now war times in Amit's family. I think some of us would have experienced that. Even when grandparents are there, they will come to rescue and it becomes a family war time. So eating time is often a battle time. And the mother is very worried here. And Amit's story is that he was a low birth weight, 2 kg baby, and he was exclusively breastfed only for 2 months. And in the IYC of infant and young child feeding, we say that the first 1,000 days is from the -9, that is in utero growth plus till the second birthday. And that is the time when his nerves are being formed, his senses are being formed, his brain is growing, his muscles are growing, and breast milk is a must. But here, after 2 months, they started giving formula or other feeds, started on thin gruels at 8 months. And gruels were given in a bottle. And mother used to grind the rice in a mixer. And everything tastes the same. And the mother is working mother, and the support from the father is also not there physically. He's abroad. And you can understand all these problems that is taking this family into a eating time, into a battle time. Look at Zara, she's 3-year-old. they are planning to send her to daycare as both the parents are working. She has been growing well, but has started to show disinterest in the food, always wants different things, just gets bored with the same food. And parents come to you for nutritional advice. This is also a real story which all of you must have come across in your own family or in the society or at least in your practice. Now, look at Ramya. 2-year-old Ramya refuses food. They tried tonics, health drinks, force feeding for a month. But Ramya lost half kg. So the parents got very frustrated. And the story is that she was a good eater as baby till the first birthday. And they have now requested the grandparents to come and help out. And you know, sometimes this may help. Sometimes this may become a big fight between the family. So we have to understand why these children are behaving like this and why the parents are getting so worried about it. First of all, we have to understand the physiological changes that is happening. And see, after 2 years, every year, the weight gain is only 2 kg per year. And the height gain is only 6 centimeter per year. And in the first year of life, also 2 kg, but there is a height gain of 12 centimeters. And by 2 years, weight becomes 20% of the adult, height becomes 50% of the adult, and the brain growth becomes 75 to 80%. And the activity of the child increases. Now they get easily distracted and they want to explore the environment and also control everybody around, including the parents, the grandparents, the teachers, whoever is there. And the appetite comes down. There is a physiological anorexia and they want to select the food. And there may only be limited variety for the child because every day there is a routine for the baby to be cooked, what is to be given to the family. And they want to self-feed, and some of them develop very erratic behavior, eating behavior. All this you know. So the growth slows down, the motor activity increases, and the appetite decreases. Sometimes we call them the terrible 2s and terrible 3s also. And so the developmental issues are slower growth, more activity. They want more autonomy. They want to, they think that they have the right to choose, but the parent is not allowing. So they throw temper tantrums. There is a genetic pattern. The parents are also picky eaters. They don't take a wholesome meal. Socioeconomic differences are there. Literacy level of the mother is very important. Then infections, daycare, the routine in the daycare, the multiplicity of the caregivers. This is very important. The mother, the granny, the grandma, the teacher, the ayah, so many are trying to feed the baby. So I can put it in a nutshell that this picky eating, whatever we call it, fussy eating or picky eating, is a feeding conflict. Actually, the parent is putting pressure to eat and the child is trying to resist. And are we in the right path? See, at 6 months, we have to do liquid to solid transition. The child should eat the complementary food and not drink it. But we often put it in a feeding bottle and give it. So the child is not given the chance or the experience to take the tongue back and then take the food inside. So when they are given liquid, they will bring forth the tongue and mother thinks that the child is pushing the food away. It is tongue thrust. And when there is a slight developmental or behavioral problem, the tongue thrust may persist a little more. So the mother is unable to understand this and she thinks that my child is refusing the semi-solid or the solid, so I have to give it in a feeding bottle. And then the stomach capacity. We know that 30 mils per kg is the stomach capacity, but we can fill only up to 20 mils per kg because there should be space for the digestive juice, the air, churning the food, etc. This is what we learned during the SAM module. That is, we start in severe acute malnutrition. We start cautious feeding, 10 to 11 ml per kg, and then we reach up to 20 to 22 mils per kg. But some mothers think that they can feed immediately up to 30 ml per kg because somebody told them 1 ounce per kg is the stomach capacity. So they are trying to overfeed. And the challenges in feeding, there are natural preferences for the sweetened food and aversion to bitter. Most children like sweet food, and the mother may be trying to give something in between, and they don't like it. And it is said that most of the poisons tend to be bitter, and the child is developing in such a way that they have a liking for sweet food, which is not often a poison, but the bitter things may be poisons, etc. Then reluctance to accept a new food, we'll be coming to it, neophobia we call it. Then offer a new food, we have to offer a new food multiple times. Food choices are influenced by taste, the marketing. The marketing is very important, and the television advertising. And most of the mothers are not getting the right type of empowerment or information from the doctors also. Traditionally, what do? We call them 1.5, 2.5, 3.5 months for immunization. After that, the next immunization in the national immunization schedule is at 9 months. So they come by 9 months, and where are they getting the advice during this period from 3.5 months to 9 months? So we have to have a visit at 6 months. And now we say that at 6th month, let them start the rice giving ceremony and let them come to you. And we can say that I will give you the right advice regarding complementary feeding, how to introduce the different types of food, etc. And often they fail to meet recommended servings of fruits, fiber, vegetables, etc. They have aversion to some food based on taste, texture, smell. If we have seen that if you introduce the food very late, say 1 year, after 1 year, they may refuse it because they already have likes and dislikes. If you start it earlier, say before 9 to 10 months, 8 to 10 months, they are likely to take it up. Neophobia, most of them have, so we have to give it again and again. But in this, the particular picky eating, it is very interesting that there is no growth failure. But some of them may have micronutrient deficiency. And look here, the taste buds. The sweet is kept in the front. So always, is there any disturbance? I am audible, I believe. Okay.
Yes, madam, you are.
I'll continue.
Dr. Arti ma'am is trying to join, ma'am.
Okay. The sweet is in the front, then comes the salt, then the sour, and the bitter. The bitter is in the back. And the fifth one is umami, we call it, that is meat-like taste. So we have to encourage self-feeding despite spillage that many mothers are not allowing. Many families do not try it out and help the child to develop fine motor skills and control energy intake. Developmental readiness is a very important word when we introduce new food to the child. Many of them have neophobia, that I said. And I have discovered that they are super tasters. 1100 taste buds per square centimeter is there. And as we grow up, the taste buds go apart. And there are only 11 taste buds per square centimeter. So they are super tasters. So if we go on giving them only sweet, only salt, they will have a liking for that. And another important thing is don't label your child as picky or problem or fussy or choosy eater, at least in front of them. And you have to understand the cues. Now we say no hunger cues in a newborn baby. Early cue, mid cue, late cue, etc. are there. They open the mouth, then they look around, then they stretch their hands and take it to the mouth, and then they cry. And here, like that, we have to know satiety cues should be known. Many mothers do not know whatever they have, the child should eat, or their stomach should be very full. Something they are looking for, tummy is full. But What are the satiety cues? In a young infant, it is unlatching from the breast, turning the head away. Then the mother should understand that enough for now. I can try it later. Then in an older child, they stop feeding, they spit out, they ignore the food, they push the cup or the spoon, they start to play with the food. This often happens, but the mother or the caretaker is still going to go on feeding the child, and the child may rebel. And picky eating is actually a developmental challenge. Unwillingness to eat familiar foods or try new foods, and strong food preferences. Most of the preferences are because it is introduced very late, or the parents are now, the child has never seen the parents taking it. Severe enough to interfere with daily routines, it may be problematic to the parent, the child, and the parent-child relationship. This is an umbrella term, that is the picky eating, and we have to think of differential diagnosis. Here I am showing Sultana. She is a 2-year-old girl. She refuses all types of food for the last 2 months. She has lost 1.5 kg. Parents are frustrated. Was eating well earlier. So this is not picky eating. This we have to understand. You can see that the child has now become malnourished and has lost significant weight. And in picky eaters, usually their weight, height, everything will be low normal, at least within the range. And here I have to find out what is the underlying cause. It may be tuberculosis, it may be some inborn errors of metabolism, primary immunodeficiency, or even infantile anorexia. Infantile anorexia is a very serious eating disorder which should not be mistaken as picky eating. They refuse to eat adequate food for more than 1 month. Onset is usually during transition phase to self-feeding, rarely communicate hunger, significant growth retardation as I have shown here, no associated medical illness, help of the nutritionist, child psychologist, and we have to help the parents to reduce the stress here. And it may be a forerunner of the anorexia nervosa, which is seen during adolescence and young adults. Good. And another differential is 5-year-old Jayant now refuses to eat. Mother took leave. Now she came taking leave, and she's trying to feed him in vain. All this started after he lost his grandma, who used to tell him stories and feed him. Actually, what is this child having? We can't call it picky eating. It is actually PTSD, post-traumatic stress disorder. We'll have to treat it in that line. And picky eaters have aversive reaction to some food, texture, taste, temperature, smell, etc. And onset is when a new food is given, and they may produce a grimace, they may spit, they may gag, they may vomit, but there is no growth failure, but may have some micronutrient deficiency, anemia, etc. No traumatic event to the oropharynx, and feeding problem not linked to allergies or medical illnesses. So we have to think of GRD, congenital anomalies like cleft palate, which was missed, undiagnosed food allergies, constipation, dental problems, excessive juice and milk intake, autism spectrum disorder, variation on taste and sensory issues, children with cerebral palsy, etc. Infantile anorexia, and do not make simple assumptions without using growth charts. We'll have to plot the growth chart. That is the second point I want to say. So picky eaters, we have to identify and support, and we should not forget the differentials, and also we should document their growth. So the reasons may be a developmental disorder, maybe a developmentally challenged child which was not easily understood, primary feeding issues or secondary feeding issues, even PTSD, all those things. So there is the toddler factors are there, the food choices, the environmental, and a pediatrician can influence the cultural practices, the knowledge, and choose wisely depending upon the affordability, and the siblings and the family also has to be taken into confidence. And when to suspect picky eating, limited number of food items in the diet, strong food preferences, likes and dislikes, unwillingness to try new food, special preparation of foods required for the baby. They have sensory issues. Then food selectivity, avoiding the intake of certain foods, limited intake of vegetables and certain other food. So there are, as Dr. Jagdish was telling, there are maternal factors, child factors, feeding practices, wrong feeding practices, wrong family interaction that is resulting in picky eating. It is a family diagnosis, actually. It is not the child alone at fault. So maternal age, higher socioeconomic status, higher education, lower pre-pregnancy BMI, maternal smoking. These are the factors which have been identified. And in child factors, low birth weight, firstborn baby, male gender, variation in sensitivity to bitterness. They don't like bitter. Erratic appetite, attention-seeking behavior, and feeding, reduced duration of breastfeeding. We have seen in Amit all these things, low birth weight, reduced breastfeeding, late introduction of chewy foods, pressure to eat, food grazing. This is also very important. They graze on snacks, and then meal times they don't like. Excessive beverages, especially the sugar sweetened beverages. Then parents have very different feeding styles. Mealtime atmosphere. Most of it is in front of the TV or when the mother is doing her work. There is a lot of family dysfunction. This is what we have to identify. And dietary diversity will be limited as a consequence. Then all the food groups may not be taken. Meat, fish, vegetables, they don't take. There may be zinc, iron, and other micronutrient deficiencies. And macronutrient intake may be maintained because they may be grazing on this and that. And free sugar intake may be very high. And energy intake may be maintained low. And so they have reduced appetite and they have carb craving. This is also another thing. Sometimes we identify picky eaters by their carb craving. And weight and height are low compared to non-picky eaters, but usually within the population norm. Similar to BMI also. And most of them may have constipation. And mothers do not know how much fiber do they need. Age in years plus 5. And I can tell you that a 5-year-old, a 3-year-old should be taking 5 plus 3, 8. And if I can give a large fruit like an apple, I can give 2 grams of fiber. If I give 2 small fruit like strawberry, I can give 4 grams of fiber. If I give a large apple, I can give 4 grams of fiber. If I give 1 root like a radish or a carrot, I can give 4 grams. And green leafy vegetables. So easily I can give 8 grams. But this information, the doctor nor the mother has. So growth assessment, looking for features of micronutrient deficiencies, physical examination to rule out other systemic diseases, and digging out all the eating habits, the parent-child interaction, the family dysfunction. This is our role. And we have to avoid parental pressures, and we have to modify the child's eating pattern. The family eating habits also have to improve. And we should encourage non-food rewards. Food should never be a reward for any kid. I'll buy you chocolates. Then they have plenty of chocolates with them. So they like only chocolates. So that is it. And in modification of child's eating, we have to have realistic expectation of the child's portion size. That is why I put the stomach size and all. Do not allow food grazing. Limiting or avoiding energy-giving drinks in between. Graded and repeated exposure to new foods. Feeding themselves. Many mothers do not allow that. Not even allow them to hold the spoon or the cup or anything. And family foods, family meal time should be there. Parents should be models, role models in how to finish the vegetables, fruits, and in trying the new food. And participate the child in selecting and allow the child and in new food. If they start buying it, sorting it, cleaning it, serving it, it becomes their product. And there should be no distraction like the screen always the iPad kid wants the iPad to be there for eating. And mothers ask, how will you feed without the iPad? And there are crores and crores of children who are reared on this earth without the iPad, that we have to tell them. And avoiding parental pressures. No force feeding, no pressure to eat. Avoid negativity. Don't say negative comments on the child. And we have to have a structured meal time. And food should never be a reward for any kid. And the meal time should be a happy time. It should be a time to interact and get the feedback. And they should have a separate seat. And feeding should be under supervision. And have you ever thought that color of your plate influences eating? It is said that a white food served in a white plate, you take more. A white pudding you will take more. Rice, white rice you take, it's said that they will take more. So this we can adapt. And we have to practice responsive feeding. I said some of the tips to that. We should be role models. And we should have a neutral attitude. Okay, your food is served. Come, we are all eating. I'll help you with this. We can say, and 30 minutes, you must say that now it is time. I'm going to take the food away. No, should not linger on for an hour, 2 hours, etc. And they should have a proper seat. And we have to tolerate age-appropriate mess. And the 90-90-90 position is very important. The hips, the knees, the ankles, all should be bent at 90 degrees. Most of the children do not have an eating place. That is very sad. They eat in front of the TV or anywhere, in the bedroom or in the sofa set. So this is very important. We have to teach them like this. And when we toilet train also, they should have a footrest. That is very, very important. And in a very difficult case, we can seek the help of the nutritionist, the child psychologist, and counsel the parents. And there is an interesting app which you can download, or some of it maybe you can get the counseling. You can even, some of it is paid also. That is called NEAT, Nutrition Education Aimed at Toddlers. That is, some others come and ask, can I have some videos or some real experience online? So this is it. I think we can also start something like that. I am giving an idea. So food refusal is a rule in the toddlers. Child will eat when hungry and they will come and ask. Do not worry about one day's poor eating. One day, if it is for a month, more than a month, you must seek help. Do not worry if your child is healthy and growing normally, and you have to be role models. And you are rigorously trying to train the child. You can call it timeout. So the food, the child is refusing, crying, then you can say timeout. And how much is the timeout? You can say, if it is for an immediate thing, I will say 1 minute per year. 1 year-old child, I will say, now you are going to stop whatever you are going to do. And I am also not going to talk to you. All are going to sit straight. And 1 minute, you are going to sit like that. 2-year-old child, 2 minutes, you are going to stop all activity and you have to sit timeout. And we can allow some timeout in between. It may not be for a minute, 1 or 2 days also we can allow. Give non-food rewards only. Do not take away rewards already earned. That is very important. Some others say, oh, yesterday I gave you this, I'm going to take it away. This toy, I'm going to take it and put it in the almirah. Never do that. Whatever rewards was given to the child, never take it. And include child in selection, cleaning, serving, encourage self-eating. Understand hunger and satiety cues. Hunger cues some of us know, but satiety cues also we have to know. And we have to prevent deficiencies, both hidden and overt. We have to tell them about the food guide, pyramid, and the plate. On a daily basis, 50% of the food should be vegetables and fruits. That is the jor part of it. Green, yellow, orange, red. Then concentrate on the protein, which is purple color here. And so the child should have enough protein. And then the grains, the roots, tubers, etc., which is the energy yielding food. And that should be a whole grain. That is why the brown color is put. They should have little bit of dairy products because they are growing. They need good quality protein and good quality calcium, which is bioavailable. And enough water they should be encouraged to take. Now in our place, Kerala, some of the schools have started this one, water drinking well. And they have to, so when they are at home, we should have a water drinking well. The child's 1 liter water is kept there and they have to finish 250 in the morning. By lunch, it should be 500, should be over like that. And we should learn how to read the labels and don't go behind advertisements. We can see that any one of these health drinks, it is said that 10 gram protein it will give. But when you give 10 gram protein, you will be definitely giving 50 gram of sugar along with it. So beware of all these advertisements and try to learn the food labels. And then they ask, what is my responsibility as a parent? The mother or the caregiver should decide where to feed, what to feed, and the child will decide how much. At least give them this option. And so introduce lumpy foods before 9 months, before likes and dislikes set in. Eat with your child at the table and make it enjoyable, not battle time. Include your child in the preparation of the meal. Give your child the choice, but don't fill the plate. Picky eating is a common behavior. Most of them will outgrow it. Don't worry over it if the child's weight, height, everything is normal. Never punish or force feed and make them rebel or dislike the food. Parents should be praised for their excellent feeding style. Or at least when they come, you must say, I am happy that you have come because you have concern regarding your child's feeding. And they should be praised not for the infant being on the normal growth curve. It is for the excellent feeding style or your concern regarding your child's eating behavior. And these should be family time. And some of these are from my own house. I have a grandchild and every day she dictates. She wants what pussy or butterfly, the dosha and all. It should be served in a very wonderful way. And this is one behavior, that is non-indulgence. The child is given, the mother goes away. Or ignoring should not happen, or force feeding. So most of the picky eating may be because of non-indulgence or ignoring the child during eating or force feeding. So to conclude, childhood nutrition is the road to lifelong health. And so we have to be very careful when we are dealing with such children. I think I hand over to the next speaker, Dr. Arti, and she will give you some of the FAQs, and I can also answer some of any queries which you have typed, or you can type in the chat box also. Thank you for the patient listening.
Thank you very much, ma'am, for that excellent overview. It's really changes the entire purview of how anybody would look at picky eaters. And you have very nicely explained how to navigate the difficult mealtime, how to navigate the tantrums, how to introduce food to children in very innovative ways, and making sure that the picky eating is something which is easily solved, but still maintaining nutrition. It was an excellent presentation, ma'am. From here, in the interest of time, we go on to just possibly summarizing what ma'am had really mentioned, and ma'am has dealt in pretty detail. She had dwelled into the different developmental stages of how picky eating develops and how it should be prevented. So only the last few slides we will go in to summarize how finally and what major FAQs are there. Prashant, can I have the slide, please?
Sure, ma'am. Dr. Elizabeth's slide, ma'am.
No, my slides.
Yeah, just a minute.
Definitely. The next slide. In the meantime, can we take a few questions which are coming up?
I think let's start with the first question. The first question was on, excellent session, madam. Little elaboration on physiological anorexia, please.
Yes, up to 1 year, the child is very receptive, and you feed them 500 ml of milk a day, 1 liter of milk a day, they will take it, and whatever you put it into the mouth, they will swallow. But after 1 year, 1 to 2 years, their growth rate is slowing down, and now their interest is exploring and mastering the environment. So there is a stage of physiological anorexia. And in the first year of life, we know the birth weight from 3 kg becomes almost 9 to 10 kg. And the length from 50 centimeter becomes 75 centimeters. And in the second year, 10 to 12 kg is all what is needed. That time now they are ambulant. They are interested in play. But their height gain is still, they become maybe from 75, they become 88. So 12.5 centimeters is added on. But after that, the growth rate is slowing down. They need gain only 2 kg per year and 6 centimeter per year till they become school children. So there is a physiological anorexia, and they will not be eating every time. That is why we have to define the meal times for them, and we have to select what, when, where the mother will have to decide.
Thank you, ma'am. There's one more question there, which says, should we give sugar and salt in complementary feed?
That's a Pandora's box, I believe, because, the first and the foremost thing is that they are super tasters. If you start giving them sugar and salt very early, they may develop a liking for more salt and more sugar. That is one reason why we should not be adding too much salt and sugar. Second thing is that their energy is already coming. Sugar is not going to be their energy, and lot of obesity is going to come if you start giving sugar early. And sodium is present in most of the food, and their kidney concentrating capacity is low. So they may not need much of salt also. But I'm telling that whenever we are preparing a special food for the child, I'm preparing a porridge for the child only, then I don't add sugar and salt. But when I'm going to family pot feeding, by 10 months or so, whatever is cooked at home, I take and then I soften it and give it to the child. At that time, everything in moderation can be given. But the American Academy of Pediatrics is telling a big no to sugar and salt. I think we can we can relate to the cultural practices and then decide individually.
Madam, shall I intervene?
Yeah.
Madam. See, there is a little bit controversy and some confusion. So when compared to European countries, in our Indian context, we prefer only homemade food. And whereas there it is industry-made food. So in the Indian context, because the lot of debate is going on, it's never ending. What the people like you are telling is, whatever mother prepares with adding salt or sugar, that is enough. The extra sugar or salt should not be added to the homemade food. But it is different from the European countries where it is industry-made food, because already it contains a lot of sugar and salt. Am I right, madam? Am I right?
Yeah, that is what we can decide depending upon the cultural practices and the individual. The food labels should be, we should learn how to read it also. But we should not be very vehemently telling no like that.
No, oh yes. So one more thing is, suppose because there is one school of thought, no sugar, no salt. So if that is the case, the palatability of the food suffers, and the child may totally refuse to eat also. And he may get attracted towards the prevailing high salty, high sugary food also. That is another disadvantage of telling no salt, no sugar like that. Am I right, madam? Right?
Yes, yes.
Yes. Thank you.
I
Ma'am,
think
there's-
Dr. Kesulu, I think the most important thing is that we cannot go to both extremes.
Yes.
Yeah.
You
Everything
cannot
in
say
moderation.
everything should be in moderation. If you say
Yes.
so, I think traditionally what we have been doing is perfectly all right. Only
Yes.
thing is that again, one important point which Dr. Elizabeth also mentioned is all feeding habits are formed in childhood. So basically, whether how much you eat, whether you snack, whether you have a tendency to eat more sugar, is all formed right from the time you are a small child. So it's important that parents understand that all the food choices and the patterns of eating are going to be set very early in life, and they should start looking at what are healthy habits to form as far as food is concerned. So I think it's a very valid point and good questions, Dr. Kish.
Ma'am, there's one more question which says when to introduce eggs, fish, and meat to a child.
I think that you must refer to the IYCF guidelines. The IYCF guideline says that 6 to 23 months, there are 8 food groups. And we can introduce one by one as per the choice of the family and the child's readiness to accept. There is nothing like that this should be delayed till this age, etc. And the different food groups, 8 food groups are the first and the foremost, and the essential food group is continue breastfeeding. Then the energy yielding food, that is cereals, which cereals, millets, etc. everybody is giving to the child. Then protein sources, that is the nuts and the legumes. That is the third. The fourth one, they say, call it egg. And the fifth one is fish and meat. And the sixth one is the yellow, orange, red, vitamin A rich food. And the seventh food is the green and the dark, that is the green leafy vegetables, iron rich food. And then comes milk and milk products. And even the asthma allergy specialists are now telling early oral challenge will reduce the risk of sensitization. So after 6 months, the leaky gut is gone. You can start at any time. But if you delay it, the chance of sensitization from other sources may be more, and also the child may develop likes and dislikes. So one by one you can introduce. There is no clear-cut time. Some people used to say that after measles vaccination only egg should be introduced. There is nothing like that now. This is the latest recommendation.
You are muted, Dr. Arti.
I think jaggery, there is one question.
There's one question whether jaggery can be added in place of sugars for complementary food. Does it make a difference?
Yeah, sugar is a almost very much processed, no? It has no taste, smell, color, anything of the sugar cake. That means it is very highly processed. That is why table sugar we are telling that it should be in moderation. Whereas jaggery is retaining some of the original properties. So that is less refined. And they claim that it has got little more iron, etc. So traditional way of adding in moderation when you go. And we don't want to give the very ultra processed one. In that way, that has got an advantage.
Ma'am, there's a question which says, which is an ideal age to give protein supplements in children in certain disease states, especially like somebody has tuberculosis and they need high protein intake. When is an ideal age and additional protein supplement may be
Up to 2 years, we do not recommend any of these things. After that, if there is a medical indication, we can.
Thank you, ma'am. So there's one related question, not exactly picky eating, but it's an interesting one, that how to address the children's eating hand habit. Usually the right and some have a habit of eating with both hands, and somehow the parents always insist them to eat with the right hand. How to tackle that, or is it important even to tackle that?
That's a very difficult question. Previously, we were so much vehemently telling that we should eat with the right hand. But nowadays they say that developmentally the child is ready to eat with the left hand. He is a left-hander. It's better not to confuse him and change it. But previously we used to say that let us change it. But now the practical advice that we get is that let them eat. But in the family, sometimes this can lead to a conflict. So I would like to hear from Dr. Arti and Chinnappa sir also regarding this.
I think Dr. Arti can go first.
I believe what ma'am says is right, that maybe we should not be forcing them to eat which way, because there are many children who are ambidextrous. It's just not the right and the left, and gradually as they grow with the development, they will many children eat with the left hand and they write with the right hand. So I don't think there's any need to change that, and let them discover their dexterity and go ahead with that. It really does not make a difference.
Absolutely. I think if you give a spoon, if you give 2 spoons to a toddler, he'll eat with both the spoons.
Both hands.
Yeah.
So I think it's ultimately the toddler's choice, what he wants to, how he wants to eat. I don't think we should interfere with that. And gradually over time, the toddler will choose however he wants to eat. Of course, there are a lot of, as Madam mentioned, socio-cultural issues on this. But I think forcing a child will make it even worse. So I think the child should be left to eat as he likes.
Ma'am, we'll take one last question, which says that spitting out of the food is more common from 6 to 12 months, and how to handle that.
Spitting out, actually, we must understand whether it is tongue thrust. Usually, tongue thrust, they will get over it. We have to put the food in the cheek then. Then they learn to take it. That is one thing.
And ma'am, there's another question which does appear good. Possibly they have asked it for a developmentally normal children, that from which age do we allow self-feed, and how do we avoid the risk of aspirations if left alone for feed? I believe this question should be addressed when we are specifically mentioning neurologically intact children, because it will differ.
Round things like nuts and all should not be given to the child. But finger pieces we can give once they have the pincer grasp.
Sure, ma'am. Thank you very much, ma'am, for answering these questions. Sir, any comments from your side?
No, I think we've gone through a full long journey with Iben, Amit, Zara, Ramya, and many other children, Jan, Sultana. So we have seen so many children with so many eating problems, and I'm sure that we have learnt a lot from this session on how to handle these children. And I think Madam has put together a varied and such a diverse subject into a very simplified way to look at it from practical aspects. So congratulations and thank you very much, Dr. Arti, for coordinating those questions. So I think it was a fantastic session. Thank you so much for bringing out all these issues.
I think this is the beginning of a big journey that we are planning, and we can have more tele-nutrition sessions. And also we are having the basic course, and the first batch is over, and Dr. Keshavulu and all have attended that course. So we invite whoever is interested to join our NIPCP course, which is going to start soon.
I'm pretty sure, and I believe we need to now exceed the capacity for the meeting to more students. Today, I think next time we should be having higher limits.
100.
Yeah, I think it was also being streamed, Madam. So there will be a lot of people who are watching it on YouTube.
Yes.
So I think, yes, we'll definitely look into getting more number of participants in the group itself.
And I think there is one question regarding milk. Actually, when a baby is breastfed, there is no need to give the baby extra milk. But there are 17 IYCF indicators, and one says that if by any chance 6 to 23-month-old baby is not breastfed, the child should be getting 2 milk feeds. So there is no time specification for that. If the baby is not getting enough breast milk or not breastfed at all, the baby can have milk feed. And you may know that we always, even from an ICU, we start giving the bovine milk, but it is in a processed form. But the processed form is not going to decrease the allergy. If so, no American child should have the eczema. We see every child who's coming from America is having a facial eczema. So they take processed milk. So it is, I think our grandparents were, actually they were cooking the milk and then giving it to the child, denaturing the protein. There was not much allergy seen in our country, isn't it? Dr. Chinnappa sir also will agree to me, I believe.
Absolutely.
Now there is more allergy, no?
Yeah, I think this is a very important point. I think the allergies have gone up due to various reasons, and not only related to only nutrition. There's so much of environmental pollution. There is contact with so many other chemical compounds, high volatile acids. There is, the child is, by the time the child is born, is already in contact with so many allergens. And so too, even the pregnant mother is also, is bombarded with pollutants and allergens. So I think it's a very complex thing. It is not only restricted to introduction of nutrition, but also environmental insults which are there. So I think this is a very complex topic. And yes, I agree that the amount of allergies are going up. And that's also basically because the number of infections are going down. We know that early in life, more infections will switch the immune system to Th1 and prevent allergies. So we also know that the infections are going down because of our sterile environment, more pollutants. So we're pushing everything towards allergy now.
The hygiene hypothesis.
Yes.
Yes.
Are we done with the question, sir?
One more. I think Naveen Kini has a very important question. After a child has received breastfeeds for 2 years, is starting cow's milk absolutely required? Anybody?
So they're asking whether
I have shown that plate method, no? Milk and milk products is one of the food groups for the growing child. So it is given as one of the food groups, just like the other food groups. Dr. Arti had some questions.
There's a question which just came, ma'am. What should we recommend to a child dependent on breastfeeding in the second year with low birth weight?
With low weight gain?
With low weight gain.
Up to 2 years and beyond. That is what the WHO and the UNICEF guideline says. And up to 2 years, we are telling it is very important because that is the window of opportunity. The first 1,000 days, it is cutting at the second birthday. And after the second birthday, if the baby and the mother wishes, and if the baby is not a picky eater, is taking all the solids and semi-solids, growing well, we don't tell the mother to stop. But if the baby is having breast addiction, takes only breast milk and does not take any solids, at that time, we tell them, okay, let us try to stop the breastfeed and increase the other type of. So individually, it has to be decided.
Absolutely.
Thank you, ma'am, for that answer. I see a question. Many children are still bottle feeding 2 to 3 times overnight, even above 1 year. Is that required, and how to stop it when they have feeding in the night?
Night feeds are not needed actually after that. In that age, because earlier the newborn baby and all doesn't have enough glycogen, and the gluconeogenesis pathways are also very less. So they need frequent feeding. But after that, they can regulate their feeding. And whenever a mother says that my baby sleeps overnight, doesn't disturb or ask for a feed, I get up and give the mother a shake hand. They are very well adjusted mother and baby diet, I believe. But it all depends upon how we train them, no? Some of them may need one feed at night. There is no harm in giving also.
One more question. Egg white and yellow together, can we start?
Actually, it is a notion that we have that yellow doesn't have the protein. Actually, the yellow also has the protein. But traditionally, because the yellow is more softer and more energy dense, we give that first. But actually, there is the notion that it does not contain protein is wrong. There is protein present in the yolk also, but most of them may take only half of it. So yolk first and then egg white is a tradition which we need not contradict. But any child or mother wants to give it full also, I allow.
Thank you, ma'am. I think so we have covered most of the questions.
Yes, madam. So I think we had a fantastic session. So we'll hand it over to Sebastian for closing it.
Yes. Thank you so much. And I'm sure this webinar, we've explored the importance of the nutrition in the modern era. And these challenges are faced by the individuals and the families in managing these fussy eaters. From understanding the factors contributing the picky eaters' behavior to implementing the practical strategies for promoting the healthy eating habits. So we have gained a valuable knowledge and tools to navigate this journey. So on behalf of Metrain, Bharati Vidyapeeth, Amrita Hospitals, Faridabad, and Telemedicine Society of India, I extend a heartfelt thanks to Dr. Elizabeth and Dr. Arti Pawaria for their expertise and dedications in sharing their insights with us today. I would also like to express our gratitude to all the people behind the screen for their dedicated support in making this webinar possible. And last but not least, a big thanks to all our audience for joining us on this Sunday on enriching your knowledge and explore a practical solution for managing the fussy eaters. And your active participation and engagement have made this webinar a success. So let's continue to apply the insights gained today and work towards creating a healthier habits in our patients and ourselves and our loved ones too. So thank you once again for being a part of this webinar. So we look forward to seeing you at our future events too. So until then, stay healthy, take care. Bye.
Thank you.
Thank you very much, ma'am.
Good
Thank
night.
you very much, sir.
Thank
Good
you.
night.
Thank you, Chinnappa sir.
Thank you, Kesalu. Bye-bye.
Thank you, madam. Thank you, Elizabeth madam. Thank you, Arti Pawaria madam. Thank you, Sebastian. Thank you. So nice. So nice.
Thank you.
Thank you, Elizabeth madam. Thank you.